Hi y'all, welcome to Partners in Health Engage's Year in Review for the 2023-2024 year. Partners in Health Engage aims to build the right to health movement by growing and amplifying the work of Partners in Health. PIH partners with communities to build healthcare delivery systems and bring high-quality care to some of the world's most impoverished communities. Since its establishment in 2011, we organize by building dedicated, well-resourced teams and by fostering alliances with groups who share our vision. We advocate for global and domestic policies that further the right to healthcare. We educate by hosting discussion groups and public lectures about the right to healthcare. And we generate resources to fund high-quality healthcare for people living in poverty. We recruit and train teams of volunteer organizers to raise funds and engage with policymakers, focusing on all actions on the three pillars of PIH Engage: advocacy, fundraising, and community building and education. Starting with a small cohort of organizers passionate about generating funds for PIH's care delivery work and building advocacy power in Congress, now in 2024, our network has grown to 89 teams across the United States, Mexico, and Peru. These teams, with 7 being outside the country, stretch from coast to coast, representing 32 states. And congratulations to our 14 new teams joining the Engage family. These teams are made up of 423 dedicated members and 5,811 supporters. These leaders have been equipped with the tools needed to effectively organize and inspire other leaders within their communities. We build a strong, engaged constituency through community building and education, resulting in the execution of 90 community building events. Participating in PIH's new Crash Course platform, engagers foster inclusivity, develop self-reflective leadership, and educate each other on past and present forces that shape healthcare systems and the path towards global health equity. 423 engagers learn thoroughly about our work through the 2023-2024 Crash Course. A huge part of Partners in Health's many puzzle pieces is generating the resource required to counter health crises caused by structural violence and effectively take on our mission of providing a preferential option for the poor in healthcare. This brings us to another pillar of Engage, fundraising. Our fundraising campaign for the Maternal Center of Excellence in Sierra Leone was supported by over 4,000 individuals. Partners in Health has invested in the staffing, infrastructure, and supplies needed to address Sierra Leone's maternal health crisis in hopes of revolutionizing healthcare in Sierra Leone and abroad. Building on previous efforts to support the construction of the MCOE, the PIH Engage Network committed to raising $125,000 this year for care at the MCOE. Engage was able to surpass this goal, bringing us to a total of $128,863, and donations are continuing to come in. These donations are being used to fund labor, delivery, blood banks, labs, essential antenatal drugs, neonatal intensive care, and post-operative services for over 600 patients. Not only have we increased the amount raised by 26.46% in comparison to last year, but we have also increased our fundraising connections by 40.26%, bringing us to 4,400 donor connections. For our fundraising events, we have successfully reached out to and engaged over 3,000 individuals, spreading awareness and garnering support through 73 events across the country. We can promote and advance the global right to health with both immediate term solidarity through fundraising and targeted political action for long-term systemic change through advocacy. In August of 2023, Partners in Health brought back the Training Institute to Washington, D.C. 1,373 advocacy actions were taken throughout the year, with many taking place at the Capitol. The goal of the advocacy campaign this year was to lobby Congress to endorse and fund ambitious 21st century global health solidarity strategies that work to make healthcare equity a reality. There were 182 meetings with members of Congress, virtually and in person, to help us achieve this goal. Thanks to our advocacy this year, we secured 6 new sign-ons for the Paul Farmer Memorial Resolution, bringing us to a total of 35 co-sponsors. We also garnered the support needed to get the Community Health Workers Access Act introduced in the U.S. Senate this spring. Even more exciting, we more than doubled our amount of appropriation requests so congressional members can hear our devotion to funding equitable healthcare. This year, there were 22 letters to the editors writing sessions and 16 published articles and related LTEs. We made our voices matter through 349 calls and 516 letters and emails to 192 congressional offices. Aruja G., a TC from Cupertino High School, states that through advocacy, it shows to us that we have a voice in this seemingly impervious world and furthers our motivation to keep on fighting for justice in the healthcare landscape. advocacy is a privilege that we use to highlight the voices that are unable to at the time. With Aruja's wise words, we come to a closing to acknowledge that these achievements are not just numbers or statistics. They represent the collective dedication, passion, and unwavering commitment of engagement supporters. They symbolize the power of advocacy, the strength of collaboration, and the profound impact that we can make when we unite for one cause. Thank you for your dedicated support and for being a vital part of this transformative movement. Together, we can and will make a difference in this upcoming campaign year.